I'm Dr. James Chen, and I spent 19 years working as an anesthesiologist at UCLA Medical Center in Los Angeles, California. During my career, I've administered anesthesia to over 8,000 patients. I've kept people suspended in that delicate space between consciousness and death, managing their pain, protecting them from the trauma of surgery, and bringing them safely back. I thought I understood consciousness. I thought I understood the boundaries between minds. On September 22nd, 2023, a patient proved me catastrophically wrong. UCLA Medical Center is one of the premier teaching hospitals in the country. Our anesthesiology department handles everything from routine procedures to the most complex surgical cases. As a senior attending anesthesiologist, I specialized in cardiac surgery cases, the long, intricate operations where maintaining stable anesthesia for 8, 10, sometimes 12 hours requires constant vigilance and adjustment. The case that changed everything was supposed to be routine. A 47-year-old patient named David Patterson was scheduled for a mitral valve replacement. His valve had been damaged by rheumatic fever in childhood and was now failing. The surgery was complex, but not unusual. I'd done hundreds of similar cases. I met David in the preoperative area at 6:30 a.m. He was nervous, which was normal. He asked me the questions everyone asks. Will I feel anything? Will I dream? Will I remember? I gave him the answers I'd given thousands of times. No, you won't feel anything. Some people dream, most don't. You won't remember the surgery itself. I explained the anesthesia process. First, medications to relax him. Then, propofol to induce unconsciousness. Then, a breathing tube and anesthetic gases to maintain deep sleep throughout the surgery. We'd monitor his brain activity continuously with a BIS monitor, a device that measures the electrical activity of the brain to ensure he stays properly unconscious. David nodded, trusting. That's what patients do. They trust us to take away their consciousness and return it safely. We wheeled him into OR 4 at 7:15 a.m. The surgical team was ready. Dr. Elizabeth Morrison, the cardiac surgeon, 2 surgical residents, 3 nurses, a perfusionist to run the heart-lung bypass machine, and me, responsible for keeping David alive and unconscious while his chest was opened and his heart was stopped. I began the induction sequence at 7:22 a.m. Midazolam first to relax and create amnesia, then fentanyl for pain control, then propofol, the white liquid that brings swift, deep unconsciousness. I watched David's eyes flutter and close. His breathing slowed. The BIS monitor showed his brain activity dropping from the wakeful state of 95, 98 down through the levels of sedation. At 60, he was lightly sedated. At 40, he was unconscious but could potentially have awareness. Below 40, deep anesthesia, true oblivion. The number settled at 32. Perfect, deep, safe unconsciousness. I intubated him, secured his airway, and began the anesthetic gases, sevoflurane mixed with oxygen. The BIS stayed steady at 32. His blood pressure was stable, heart rate normal, every parameter exactly where it should be. Dr. Morrison made her first incision at 7:45 a.m. The surgery proceeded normally. Through the careful dissection of tissue, the sternotomy, the splitting of the breastbone, and the preparation for bypass. At 9 a.m., David's heart was stopped, his circulation maintained by the heart-lung machine. Dr. Morrison began the delicate work of replacing the damaged valve. At 9:47 a.m., something happened that shouldn't have been possible. David's blood pressure spiked, not dramatically, but enough to catch my attention. I checked the monitors. BIS still at 32, deeply unconscious, but his heart rate was increasing, blood pressure climbing. These were signs of light anesthesia, of awareness, but the BIS monitor was telling me his brain was in deep unconscious. I increased the sevoflurane concentration. The vital signs should have stabilized. Instead, David's blood pressure spiked higher. Heart rate increased to 95, then 102. "James, what's going on?" Dr. Morrison asked, looking up from the open chest cavity. "I'm not sure. His monitors show deep anesthesia, but his vital signs suggest awareness. I'm given more medication. I administered additional propofol, a large bolus that should have deepened his anesthesia significantly. The BIS monitor flickered, then settled at 28, even deeper unconsciousness. But his blood pressure continued climbing, 145 over 92, then 158 over 98. And then David spoke, not with his mouth. He was intubated, a tube down his throat, unable to physically speak. But I heard his voice clearly in my head, not imagined, not hallucinated, as clear as if someone was standing next to me, speaking directly into my ear. "Dr. Chen, your sister's name was Mei Ling." I froze. Every muscle in my body went rigid. No one in this hospital knew my sister's name. She had died when I was 8 years old. I was now 51. I hadn't spoken her name out loud in over 40 years. "James, are you okay?" Dr. Morrison was looking at me. Did anyone hear that?" My voice came out strangled. "Hear what?" The voice came again. "She drowned in the pool behind your house, July 14th, 1980. You were supposed to be watching her." My hands started shaking. I gripped the medication cart to steady myself. This was impossible. David Patterson was unconscious. The BIS monitor confirmed it. He couldn't be speaking. And even if he was somehow aware, he couldn't possibly know about Mei Ling. She was 5 years old. You were 8. Your mother asked you to watch her while she answered the phone. You were angry because you wanted to watch cartoons. You went inside. When you came back, Mei Ling was at the bottom of the pool. I felt bile rise in my throat. These were memories I had buried so deeply that I'd almost convinced myself they weren't real. After Mei Ling's death, I developed severe dissociative amnesia. The trauma was so profound that my brain had locked away most of the details. I remembered she had died. I remembered it was a drowning, the specifics, the fact that I'd been supposed to watch her, that I'd chosen cartoons over my responsibility. Those details had been hidden in the darkest corners of my mind for decades. You blamed yourself. Your parents never blamed you directly, but you knew. You could see it in your mother's eyes. That's why you became a doctor. That's why you chose anesthesiology. You wanted control over consciousness, over that boundary between life and death that you couldn't control when Mei Ling slipped away. "Stop," I whispered. "Stop it." "Dr. Chen?" One of the nurses was looking at me with concern. "Are you all right?" I realized I had spoken out loud. I checked David's monitors again. BIS at 28. Blood pressure still elevated, but starting to come down as the additional medications took effect. I administered more fentanyl, trying to suppress whatever was happening. The voice continued, softer now. "I'm not trying to hurt you, James. I'm trapped in here with you. When you put me under, something happened. I can feel your consciousness. I can access your memories. I don't know how. I don't know why. But I'm here, inside your mind, and I can see everything." I looked down at David Patterson's unconscious face. His eyes were closed. The BIS monitor showed deep unconsciousness. By every measure of medical science, this man's conscious awareness should not exist right now. His brain was suppressed to the point where even autonomic functions were being carefully managed by my medication. Yet, somehow, impossibly, he was not only conscious, he was inside my mind. I can see the memory playing like a film. You, 8 years old, in your living room. The phone rang. Your mother asked you to watch Mei Ling. You said okay, but then your favorite show came on, Transformers. You thought would be fine. Just 5 minutes. The pool gate was closed. She couldn't open it by herself. Except she did. You don't know how. When you finally went outside, you saw her pink swimsuit at the bottom of the deep end. You jumped in. You pulled her out. You screamed for help. Your mother ran out. She did CPR, but Mei Ling was already gone. Tears were running down my face, inside my surgical mask. I couldn't breathe. I couldn't think. 43 years of suppressed guilt was crashing over me like a tsunami. "James, I need you to focus." Dr. Morrison's voice cut through my spiral. "We're about to come off bypass. I need you present." I forced myself to concentrate on the monitors. We were reaching the critical phase where David's heart would need to take over circulation again. I had to be perfect. I had to be present. I couldn't let my psychological breakdown kill my patient. I managed the transition. David's heart began beating on its own. The bypass machine was disconnected. His vital signs stabilized. The surgery continued toward closure. But the voice didn't stop. "You never told anyone the truth. Your parents thought Mei Ling opened the gate and went to the pool on her own. They thought you were inside unaware. You let them believe that. You let them think it was just a tragic accident, that no one was at fault. But you knew you had made a choice. You chose cartoons over your sister's life. Please," I begged silently, not speaking aloud. "Please stop. I will. When the surgery's over, when you bring me back, I won't remember any of this. That's how anesthesia works, right? Amnesia. But right now, in this space between consciousness and unconsciousness, we're connected. And I need you to know that I can see who you are. All of you, including the parts you've hidden from yourself." The surgery concluded at 1:15 p.m. Dr. Morrison closed David's chest. I began the process of bringing him out of anesthesia. I decreased the concentration of sevoflurane. I stopped the propofol infusion. I watched his BIS monitor as his brain activity slowly climbed back toward consciousness. At BIS 60, David's eyes began to flutter. At BIS 75, he started breathing over the ventilator. At BIS 85, I removed the breathing tube. At BIS 92, David opened his eyes and looked at me. His eyes were confused, disoriented, exactly what you'd expect from someone emerging from anesthesia. There was no recognition, no memory of what had happened during the surgery. "How do you feel?" I asked, my voice carefully professional. "Tired," he mumbled. "Did it go okay?" "The surgery went perfectly. Dr. Morrison replaced your valve. You're going to be fine." He smiled weakly and closed his eyes. Within minutes, he was asleep, natural sleep this time, not the enforced unconsciousness of anesthesia. I completed my documentation and left the OR. In the locker room, I sat on a bench and put my head in my hands. What had just happened? Had I experienced some kind of psychotic break? Had the stress of the job finally caught up with me after 19 years? Was I developing schizophrenia? But the details, the specifics, things I hadn't consciously thought about in over 4 decades. David Patterson, a man I'd met for 15 minutes in pre-op, had accessed memories I didn't even know I still had. I went to the hospital's psychiatry department. Dr. Sarah Winters was someone I'd worked with occasionally. When patients needed psychiatric consultations before surgery, I trusted her. I told her everything. She listened without interrupting. When I finished, she was quiet for a long moment. "James, what you're describing sounds like a dissociative episode triggered by the stress of surgery. The human mind can create incredibly detailed false experiences under pressure." "I know what a dissociative episode is, Sarah." This wasn't that. The details he knew that I supposedly created were accurate, things I had genuinely forgotten. Repressed memories can resurface spontaneously. Perhaps something about this patient reminded you of your sister, and your unconscious mind created this experience as a way to process that trauma. I visited David Patterson in the ICU that evening. He was awake, recovering well from surgery. I asked him carefully if he remembered anything unusual about the procedure. "Nothing really," he said. "I remember them putting me to sleep. Then I woke up and it was over. Pretty standard, right? Did you experience anything during the surgery? Any sensations, any awareness?" "No, nothing." "Should I have?" I shook my head. "No, amnesia is a normal part of anesthesia. I was just checking." But as I was leaving, David called out, "Dr. Chen?" I did have one weird thing. When I woke up, I felt sad, really deeply sad, like something terrible had happened, but I don't know why. It faded after a few minutes. Is that normal? I felt cold spread through my chest. Sometimes anesthesia can cause strange emotional states. It should pass. He nodded, seeming satisfied with that answer, but I noticed something else. His eyes lingered on me for a moment longer than necessary, as if he was trying to remember something just out of reach. A fragment of a memory that didn't belong to him. A glimpse of a little girl in a pink swimsuit at the bottom of a pool. Dr. Chen, he said softly, I hope you're okay. You seem troubled. Whatever's weighing on you, I hope you find peace with it. I left without responding. How could I tell him that he'd already given me that peace, even though he'd never remembered doing it? Over the next 3 months, I tried to continue my practice normally, but every time I administered anesthesia, I wondered if it was happening again. Was I connecting with my patient's consciousness? Were they accessing my mind? It never happened again. Every surgery was normal. Every patient went under, stayed under, and emerged with no memory and no connection to my thoughts. But the fear remained. I started documenting every case obsessively. Patient demographics, surgical procedures, anesthesia protocols, any unusual responses. I was looking for patterns, trying to understand what conditions had created the connection with David Patterson. Was it the specific combination of medications, the duration of surgery, something about the cardiac procedure itself, the stopping and restarting of the heart? I became obsessed with understanding what had happened. I researched consciousness under anesthesia, finding studies on awareness during surgery and quantum consciousness theories. I discovered research from the 1970s on telepathic anesthesia events, cases where patients reported mental connections with surgical teams. The research had been discontinued due to controversy. I even reached out to physicists working on quantum entanglement, asking if consciousness could theoretically become entangled the way particles do. Most didn't respond. One told me I was wasting my time on pseudoscience, but another sent me a paper on quantum coherence in microtubules within neurons, suggesting that consciousness might have quantum properties we don't yet understand. None of it brought me closer to answers. I was a medical doctor trying to solve a problem that might not even be medical. I tracked down other anesthesiologists who had reported unusual experiences. I found one doctor in Boston who described something similar, hearing his patient's voice in his mind during surgery. What did you do? I asked him. I left anesthesiology, he said quietly. I couldn't trust myself anymore. 3 weeks later, I was scheduled for another cardiac surgery. As I prepared the medications, I felt overwhelming anxiety. What if it happened again? What other buried memories might be exposed? I called in sick. It was the first time in 19 years I had ever missed a scheduled surgery. The next week, I did it again. The hospital administration called me in. They were concerned. Was I struggling with something they could help with? I told them I needed a leave of absence, personal reasons. They granted me 3 months. The hospital administration called me in for a meeting. They were concerned. Was I ill? Was I struggling with substance abuse? Was there something they could help with? I told them I needed a leave of absence, personal reason. They granted me 3 months. During that leave, I visited my parents for the first time in 5 years. They were elderly now, living in the same house where Mei Ling had died. The pool had been filled in decades ago, replaced with a garden. I sat with my mother in the living room. My father had passed away 2 years earlier. She looked so small, so fragile. I hadn't realized how much she'd aged. Mom, I said, I need to tell you something about the day Mei Ling died. She looked at me with sudden fear. James, no, we don't talk about that. I need to. I've needed to for 43 years. I told her everything. how I'd been supposed to watch Mei Ling, how I'd chosen to go inside to watch TV, how I'd found her in the pool, how I'd lived with the guilt every single day since. My mother listened in silence. When I finished, she was crying. "James," she said, taking my hands, "we knew. Your father and I knew you had been inside. We knew you were supposed to be watching her, and we never blamed you. You were 8 years old. It was our responsibility to keep her safe, not yours. We failed her, not you. But you looked at me differently after. I could see it. We looked at you with worry, James, with fear that the trauma would destroy you the way it almost destroyed us. We saw you becoming more withdrawn, more isolated. We didn't know how to reach. We thought if we didn't talk about it, you could move on." Wrong. For the first time since Mei Ling's death, I let myself cry in front of my mother. We held each other and grieved together, something we should have done 43 years ago. When I returned to Los Angeles, I met with the chief of anesthesiology and resigned. I told him I was pursuing a career change, that I wanted to work in pain management instead of surgical anesthesia. He was disappointed, but understanding. The truth was, I couldn't go back, not because I was afraid of what might happen, but because I now understood something fundamental about my work that I couldn't unknow. When we administer anesthesia, we don't just suppress consciousness, we dissolve the boundaries that separate one mind from another. Under the right circumstances, in the right patient, with the right combination of medication and stress and quantum possibility, those boundaries can disappear entirely. David Patterson had fallen into my consciousness. He had accessed memories I had buried so deeply I'd forgotten they existed. And in doing so, he had forced me to confront the truth I'd been running from for 43 years. The medical board reviewed my resignation. I submitted detailed documentation of my career, my surgical outcomes, my exemplary record. They asked if I was leaving due to impairment or misconduct. I assured them I wasn't. I was simply choosing a different path. But I also filed a formal case report with the Anesthesiology Board. I documented everything that had happened with David Patterson, the impossible consciousness connection, the accessed memories, the patient's unexplained sadness upon waking. I knew it would be dismissed as a stress reaction or psychological episode, but I needed it on record. If other anesthesiologists experienced similar events, maybe someone would eventually see the pattern. I now work at a chronic pain clinic. I manage medication regimens. I do nerve blocks and epidural injections. I help people live with pain rather than temporarily erasing their consciousness. It's meaningful work, but it's not anesthesiology. The transition was harder than I expected. For 19 years, my identity had been tied to the operating room. I was the person who guided patients through the valley of the shadow of death and brought them back safely. Now, I was just someone who helped manage chronic back pain and arthritis, but it was also freeing. In the pain clinic, my patients are always conscious, always present. There are no hidden spaces where consciousnesses might merge, no dissolved boundaries between minds. What I see is what exists. The simplicity of that feels like a gift. Sometimes I wonder if David Patterson ever thinks about his surgery, if he has any unconscious memory of the time he spent in my mind, if he dreams of a little girl drowning in a pool, a tragedy that wasn't his, a guilt he didn't earn. I'd tried to contact him once, about 6 months after his surgery. I wanted to ask if he'd experienced anything unusual, but his phone number had been disconnected. When I called the hospital, they told me David Patterson had died 3 months after his surgery, not from his heart. His valve replacement had been successful. He'd died in a car accident. I don't know what to do with that information, but I think about him often, the man who accidentally wandered into my consciousness and found the truth I'd been hiding from myself. Anesthesiology is built on the assumption that consciousness is local, contained, individual. We believe that when we suppress brain function, we suppress awareness. And for 99.99% of patients, that's exactly what happens. But what about the others? What about the patients who slip through the cracks of our understanding, who exist in that liminal space between consciousness and unconsciousness, who find themselves connected to their doctors in ways that shouldn't be possible? I reported my experience to the anesthesiology board. It's now part of my permanent record. A documented case of possible awareness under anesthesia with unusual psychological symptoms. That's the official language. It doesn't capture what really happened, but it's as close as medical documentation can come to saying, sometimes consciousness does things we don't understand. I've started seeing a therapist. We talk about Mei Ling, about the guilt I carried for so long, about the forgiveness my mother offered that I couldn't accept until David Patterson forced me to confront it. The therapist asked me once if I thought the experience was real or a hallucination. Does it matter? I said. Whether David's consciousness actually entered mine or whether my unconscious mind created that experience to force me to face my trauma, either way, the result is the same. I confronted a truth I'd been avoiding for 43 years. I found a kind of peace I didn't know was possible. But you left your career because of it. I left because I couldn't trust the boundaries anymore. Every time I put someone under anesthesia, I'd wonder, where does their consciousness go? If it doesn't just shut off, if it exists somewhere in a suppressed state, what is it experiencing? Who is it connecting with? Those are philosophical questions, not medical ones. That's the problem. Medicine treats consciousness as a switch, on or off. But what if it's not? What if consciousness is something more fluid, more interconnected than we realize? What if anesthesia doesn't turn it off, it just redistributes it? My therapist doesn't have answers. No one does. I live with the uncertainty, with the knowledge that for a few hours on September 22nd, 2023, I shared my consciousness with another human being in a way that shouldn't be possible. That David Patterson saw the darkest, most shameful parts of my psyche and gave me the gift of confronting them. Sometimes, late at night, I wonder if he's still out there somewhere. Not his body, that's gone, but his consciousness. Maybe when we die, we don't disappear. Maybe we redistribute the way I think consciousness redistributes under anesthesia. Maybe David is connected to someone else now, sharing their mind, seeing their secret. I hope wherever he is, he's at peace. I hope his brief journey into my consciousness didn't leave him scarred the way Mei Ling's death scarred me. And I hope that somewhere, in whatever form she exists, Mei Ling knows that I finally forgave myself because of a patient who felt everything while feeling nothing. A man who was unconscious but aware. A consciousness that wandered into mine and changed me forever.